Hey Mavericks, welcome back to Ask a Maverick. So we got some questions. Amy says, why don't you provide medications and dosage recommendations for each of your blocks in the online didactic modules? One of the things that we have always really stressed in Maverick is that you got to think on your own. You can't use a recipe and a cookie cutter model of what to do every time. If I'm doing a median nerve block for a carpal tunnel release, that surgery is going to be over with in 15 minutes, and essentially the patient has very little pain following it. Why would I give that patient a 30-hour block, a 24, 30-hour block for that? I don't need that, and it increases their risk of neurotoxicity to do that. But let's say I'm doing a rotator cuff repair for an interscalene block. I'm doing interscalene for a rotator cuff repair. That interscalene is going to provide me 24, 36 hours. I want as long a duration for that injection, for that nerve block, because that rotator cuff repair is going to hurt like the devil for a long time. So we're going to try to get as long a duration as possible for that case in surgery. So we're promoting not a cookie cutter, do the same thing for every injection and just give you dosages and recommendations. We want you to think outside the box. We want you to think about your surgeon. How long does he or she take? What is the stimulation of that surgery when you're done with that surgery? What's going to be your post-op pain? What do you need out of that block? Do you need long duration? Do you need a really dense block for a few hours and then you need it to wear off so you can get motor strength back? Do you need sensory but no motor block? You know, when we're doing our knees now, we don't want FEM blocks. We don't want anything that would create a motor loss and create a weakness, because they're going to get that patient up walking that afternoon. So there's goals that you should be looking at, and you should tailor that block, your medication and your dosages to the needs of that patient and that block. Maybe I really want a long duration. I want to try to get 3 days. Well, there's no reason to use 0.5% Marcaine as your initial single shot. Put a catheter in. I only need about 3 hours. I want to dose that catheter when the patient's in recovery, so I know the catheter's working, so I can send them home with it with a working catheter. If I give them a 24-hour block with 0.5% Marcaine and Decadron and Presidex, now the patient's sitting at home. 24 hours later, if the catheter's not working, now they're going to start hurting. They're going to have to come back to the hospital. They're going to have it reevaluated. Why wouldn't I do a really short-acting initial block so that I get 3 hours? The patient's in recovery after surgery. We dose catheter. They go pain-free. Now we send them home with what we know is a working, successful catheter placement, and they're not going to come back and they're not going to hurt. You see what I mean? So everything you do is going to be designed to what is your goals for that particular patient in that particular block. So we want to thank everybody for their questions. Enjoyed answering them. Hope you got something out of it, and we look forward to seeing you at the next Maverick course.